Hi, today my topic is infertility. This lecture mainly helps the FCPS students. I will discuss a little bit about the causative factors and the treatment options for the infertility and how to proceed if you will get a case of infertility in your examination. So, infertility is inability to conceive after 1 year of unprotected sexual intercourse. That means the couple is living together for a year or more than a year without using any contraception and is unable to achieve a clinical pregnancy. Normally, 85 to 90% of the couples achieve pregnancy within 18 months of the time period. For the remaining 10 to 15% of the couples, there are causative factors or the contributing factors for infertility, and those factors are the male factor or the husband, which account 40% of the cases, female factor or the wife, and that account another 40% of the cases. And when both male and female are involved, then it accounts the 10% of the cases. And when there is no identifiable cause is found, that means everything is normal, and it is called unexplained infertility, and it accounts another 10% of the cases. So when the couple come with the complaint of infertility, first we evaluate the male factor or the husband, because most of the investigations for female are invasive. So first test is the semen analysis. According to WHO, normal values for semen analysis are 50 or 20 million should be the sperm count, 50% of which should be motile, and 4% should have the normal morphology. If semen analysis is not normal, take detailed history of the husband and examination including both the general physical and the focused or local examination of the pelvis, and do investigations in the lab according to the complaint in the history. If all these three things show any of the abnormalities, like any endocrine abnormalities such as diabetes or the thyroid diseases or any other problem, they should be treated accordingly. And if there is any local problem is found, like varicocele, hydrocele, or the undescendant testes, they should be treated accordingly. Once the treatment is done, then semen analysis become normal and the pregnancy will achieve. But in case if there is severe oligospermia or azoospermia or necrospermia, then the treatment option is IVF. I will discuss that in this lecture later on. So the IVF or ICSI is the treatment option. Now we will proceed with the female factor. Now we will proceed with the female factor of the wife. And in female, Anovulation is relatively common cause of infertility in female and account about 25% of the cases. So anovulation results from mainly hypothalamic pituitary ovarian axis dysfunction or other endocrine abnormalities. So I'm not going in detail of these problems, but usually the hypothalamic pituitary insufficiency, or there may be axis dysfunction, and there might be premature ovarian failure. So whatever the cause, the test for to see if ovulation is occurring or not is a 21-day progesterone level or the mid luteal progesterone level. If the test is not normal, we can repeat the test for the next 2 to 3 cycles, because sometimes ovulation doesn't occur naturally. The second common cause of infertility in female is a structural or anatomical problem of the female genital tract. And anatomical problems or structural problem in female genital tract. So there might be a problem in the cervix, like the cervical stenosis or cervical inflammation or hostile cervical mucosa. There might be a problem in the uterus, such as malformation of the uterus or fibroid of the uterus. In this category, tubal blockage is most important, is the most common cause in this category, and tubal blockage mainly result from the salpingitis. Previous salpingitis because of the use of might be used of the IUD. That's why IUD is contraindicated in nulliparous women, and tubal blockage may also be due to the endometriosis that cause adhesions in the tube. Other problems in the pelvis might be there, and endometriosis also cause adhesion in the pelvis. So now the test to see the tubal blockage is the hysterosalpingogram. Tubal patency test. Now the tubal patency test is done by hysterosalpingogram, and also the laparoscopy is done. The advantage of laparoscopy is that we can do the adhesion lysis at the same time while doing the abnormalities in the female genital tract, and we can find any other structural problem other than the tubes in the female genital tract with the laparoscopy. Now the treatment in female is the induction of ovulation. So the controlled ovarian stimulation or induction of ovulation is done via clomiphene citrate. There are many medications to do induction of ovulation, but the mainly used is the clomiphene citrate in 50 milligram starting dose. Clomiphene citrate is an anti-estrogen. It's given from the day second of the menstrual cycle to the day for the 5 days, like second, third, fourth, fifth, and sixth day, and then the next day transvaginal ultrasound is done for the follicle growth tracking. If the leading follicle is 20 millimeter, then it's a good response. If any case induction of ovulation doesn't occur, then we can raise the dose of clomiphene citrate to 100 milligram, 100 to 150 milligram for the next 2 to 3 cycles. Once the ovulation achieves the more than one follicles may be matured, so the multiple pregnancy can occur. So once the ovulation occurs, then ask the couple to do coitus for the next 2 to 3 to 4 days, or IUI is done, intrauterine insemination, in which semen from the sperms from the washed husband's semen is injected into the uterus and via catheter. So via catheter, semen is injected into the uterus, and the pregnancy achieved. In case of failure of induction of ovulation, the other treatment option is the IVF or ICSI, in vitro fertilization, or intracytoplasmic sperm injection. Two things are important for IVF. Number one is the selection of the patient, and number two is the cost. It's a really expensive procedure, so discuss with the patient about that. And then the indications for IVF. So the failure of induction of ovulation, severe oligospermia or azoospermia, and there's a tubal blockage, or if there is unexplained infertility. Now the steps of the treatment of IVF or infertility is a controlled ovarian stimulation, or the induction of ovulation is done via short or long protocol, but I'm not going to discuss these protocols in this lecture. As I said, how to proceed if you will get a case of infertility in your examination. So, and then the patient monitoring comes. Via transvaginal ultrasound, and the follicle size should be to see the follicle growth tracking, and follicle size should be 18 to 20 millimeter, and the hormonal levels are done. Estradiol level is high according to the number of follicles matured, and then the ovum pickup is done. Usually 5 to 7 eggs are picked and they are transferred into an incubator which has a temperature of 37 degrees Celsius and the oxygen saturation of 5%. Then per egg 50,000 sperms are added into a dish, and then next day fertilization occur. At the same time, I will say about a little bit about the ICSI. In ICSI, if there are problems in the testes like blocked testes, I mean if the semen cannot come out, then the sperms from the husband washed semen are injected directly into the egg, and this is called intracytoplasmic sperm injection. And then the next day fertilization occurs. After 3 to 4 days, embryo is transferred into the uterus, and then pregnancy achieved. There are complications of IVF or the ICSI, and those are failure of the treatment, so the success rate is only 40%. Cost of the treatment is also an important factor, so patient is might be upset, and emotional upset of the patient because of the failure of the treatment, so the psychological support might be needed. And ovarian hyperstimulation syndrome is a rare complication. So I think, if you get a case of infertility in your examination, first of all, evaluate the male factor, do semen analysis. If semen analysis is not normal, take a detailed history, physical examination, and including both general physical and the local examination, and also the investigations. If all three shows any abnormality, they should be treated accordingly. And then if there is severe oligospermia or azoospermia, we will do the IVF or ICSI. And for female factor, most common cause is the anovulation, and anovulation result from hypothalamic pituitary ovarian axis dysfunction. So to see if the ovulation is occurring or not, the test is 21-day progesterone level, and we can, if it is not normal, repeat it for the next 2 to 3 cycles, because sometimes ovulation doesn't occur naturally. And the other common cause may be the anatomical or structural problem in the female genital tract. So to see that, do the hysterosalpingogram and laparoscopy, so we can see the tubal blockage and other problems with the laparoscopy, and we can treat at the same time with the help of can do the adhesiolysis at the same time while doing the laparoscopy. And then the treatment in female is the induction of ovulation, and which is done with the clomiphene citrate. If ovulation doesn't occur, we can raise the dose of the clomiphene citrate to 100 to 150 milligram. And if in case of treatment failure, the other treatment option is the IVF or the ICSI, in which, so indication for IVF is the severe oligospermia or azoospermia or necrospermia or the failure of induction of ovulation, tubal blockage, or if there is unexplained infertility. I discuss a little bit about the steps of uh, IVF. Hope uh, you get those steps, and there might be sometimes there are the complications of the IVF, and most common is the failure of the treatment, because 40% of the cases, 40% is the success rate, and there might be emotional upset can occur. For that, psychological support is necessary, and rare complication is the ovarian hyperstimulation syndrome. Hope this lecture will help you in preparing your case of infertility in examination. Thank you.